Hi, my name is Gwen Jackson, and this is my patient, Deborah Relaford, good friend of mine. She has agreed to become my patient. I'm going to be doing an assessment of the musculoskeletal system. And of course, with the start of any assessment, you first start by washing your hands. So after washing your hands, you explain to your patient what you're going to do. Hey, Deborah, I'm going to be assessing your musculoskeletal system, which means I want to test your joints to make sure there's no popping, clicking, or pain. And I want to see how you walk a little bit. Is that okay?
That's okay.
All right. So my patient has agreed to allow me to conduct an assessment of the musculoskeletal system. The first portion, or the first part that I'll do, is the sit down stuff, or stuff that they would be in a laying down position, to ensure that there's not a bunch of up and down on the assessment. But I'll first start as I was talking with her and observed her jaw motion. So I wouldn't specifically ask to do that test, because when you are doing assessment, you kind of start off initially. So she was talking to me, her speech wasn't slurred, but I saw good movement of her jaw joint, so that was fine. But what I want her to do is kind of a rotation of her jaw, because we didn't. Okay. She has good rotation, and I didn't hear any popping or clicking. But after that, I'll explain that I'm going to test the joint in itself, and you'll feel a little pressure at your jaw joint, okay? And that is the temporal mandibular joint. I just want you to kind of go up and down, okay? Good smooth joint movement, no popping or clicking. Are you having any pain or discomfort with that?
No.
Okay. In addition to that, I would then move to the neck, and basically have her move her neck back and forward. Okay, that's flexion and extension of her neck. Now go in a circular motion. That's rotation of the neck, and it's not painful or anything when you do that.
Good.
Feels good. All right. And once I go from the neck, I will then go to her shoulders. Extend your arm out. This is extension of her shoulder, and of course going down, flexion and extension, but I'll have her go in a rotating motion, and with that I'm not feeling any popping or anything like that. Are you having any pain or discomfort?
No.
Okay, and once I finish with the shoulder, I will move to the elbow, flexion and extension of the elbow. It's really not a rotation method of the elbow because you got it in the shoulder, but I would basically do flexion and extension, and I don't feel any popping. And at that time, I would look at her joints, and I would be looking for any redness or swelling. In her joint, there is no redness or swelling. So once I finish with that, I'll go down to her wrist and do flexion and extension, and there is a rotation of the wrist, and I don't feel any popping or anything. Is there any pain or discomfort with this? Okay. Finally, moving down to her fingers, phalanges, metacarpals. Flexion and extension, rotation, no popping or anything like that. Is this painful?
No.
I would do this on both sides, and with each one of her fingers I would perform an assessment, and all is normal. Now I will move down to her lower body, which I would test her hip. And it's easier to do in the bed, and I am aware of that, but since we're in a chair, we'll kind of make shift. Basically, I want you to extend your leg out and bring it towards me. This would be flexion and extension of her hip joint. Now, I want you to take your hip and just kind of do like you did your shoulder in a rotation.
My hip?
Your leg. Just take it, because I'm testing your hip joint with this. Now, it would take your hip to do that. You wouldn't be able to do this without your hip involvement, and there's no pain or discomfort or anything with that.
No.
Okay, and of course, if she was undressed, I would be feeling her hip joint to make sure that there's no popping or any complaints of pain with that. And since she said, woo, I know her, that's a sign that, ooh, that felt good. So there isn't any pain with that hip abduction and movement. So then I would move down to her knee joint, and basically have her bend her knee and go up, flexion and extension of her knee, and there's no popping. And if she was undressed, I would be inspecting that joint for any redness, swelling, or a feeling of discomfort. Moving down, we'll go down to her ankle and basically do the same thing. That's rotation of her ankle. Do like this, flexion and extension. No popping or anything like that, and I feel her joint. and it's not swollen. I can actually feel there's no puffiness, and it feels good. And I would do exactly as I did her fingers on her metatarsals, is kind of take them individually and move them around and note any abnormalities, any deformities, or any swelling or anything like that. So I've done a complete musculoskeletal assessment. I would start head to toe, basically working my way down, and I would do it bilaterally on both sides. So now we're going to do a test of her coordination, and I'm going to observe her gait and her walking. So with that, the first thing we'll do perhaps is heel to toe. We'll do the heel to toe. And at that, this is a test of the coordination. She has good heel to toe. She's not swooping over or falling. Coordination would be nose to finger to nose. So I'm going to test your finger to nose. And we'll do it on both sides. So she'll do that. And another test of the coordination is the heel to shin. When you're testing the heel sliding down the shin to the big toe. And that's basically a test of coordination. And they will basically just kind of do it on both sides, gliding down her shin. Another test I would do is her posture, and kind of watching her ambulate or walk towards me. So let me see you walk towards me, Miss Stella. Alrighty. And her gait is steady. Each one of her steps are equal, so she's done good on her gait. There's no evidence of any abnormalities. Okay, test her walking back. Alrighty, her spine, last but not least, I would test flexion of her spine, flexion and extension of her spine, and basically if she was undressed, I would just look at her spine, just observing any abnormalities. And then I would feeling for any kyphosis or scoliosis or anything in her spine. At this point, it appears to be normal. I would then do a flexion and extension. So I'm going to have you bend down, just bend down. And come back up. Now, kind of go to the back, kind of as far as you, there we go. Good job.
That feels good. And I can do that again?
You can do it again if you want. See, no evidence of pain, so this is normal. So I've tested her spine with flexion and extension of her spine. So a complete musculoskeletal assessment consists of the coordination, the sensory, which I forgot, but I'm going to do it. Basically, in the palm of the hand, I will take a paper clip on an object that has a pricking feeling and a smooth kind of feeling, and a paper clip most identifies as that. But you'll basically just kind of go in the palm of the hand and have the patient identify whether it's pricking or smooth.
Smooth.
Okay, so I've done that. Complete musculoskeletal assessment consists of finger to nose, heel to shin, heel to toe, which is coordination, the 2-point discrimination, which is sensory. I would inspect and palpate all her joints, noting any abnormalities, observing gait and posture, upright, flexion and extension of the spine, and then I would name all the range of motion positions in regards to flexion and extension. I would test the muscle strength, and which I forgot in my assessment, but since I had my 3x5, it helped me. Basically having the patient to kind of squeeze my joints, okay? As I'm pressing down, I want you to kind of press up, okay?
Okay.
So you, okay. And that will test the muscle strength of the joints. I would do that. Hip, head, neck. And I think that's all it. I think it concludes my musculoskeletal assessment. Thank you.
Bye.